Nigerian hospitals, including the renowned Obafemi Awolowo University Teaching Hospital, are shutting down wards as doctors and health workers relocate abroad due to poor working conditions and recruitment failures. The Nigerian Association of Resident Doctors, NARD, confirmed a worsening shortage of medical professionals, with the Behavioural Science Psychiatry section of the hospital being the latest casualty. NARD President Dr. Dele Abdullahi warned of the dire consequences, revealing that a one-for-one replacement policy is proposed to address the acute shortage, with 900 doctors leaving the country between January and July 2023 alone. He emphasized the urgency for government intervention to avert further deterioration as the healthcare crisis deepens, with hospitals grappling to provide adequate care. To discuss this, we're joined by Dr. Tunji Mebawondu, a medical practitioner and CEO, Medway Health Limited. Good to see you and thank you for joining us.
It's so wonderful. You are yet to run away.
No, I'm not. What specific factors within Nigerian hospitals have contributed to the mass exodus of doctors and health workers relocating abroad?
Ask those doctors. The number one factor is actually poor remuneration. Those doctors are poorly paid. The rising insecurity is compounding those conditions of poor payment. If you look at the hospital environment also, you will discover that the necessary kits and equipment that they need to work are not available. Government has been paying a lot of lackadaisical attitude towards doctors and health workers. They don't want to listen to them. Repeated strikes is left unattended to. Nobody, they cannot even be proud to say that my children can go to school, I can afford good things of life. And we look at it. They are so few in numbers. The workload is so much. You see a doctor doing the work of 10 people. And of course, all this load will actually come back to doctors. You remember recently, in Lagos alone, about 15 doctors died within how many months? Okay? So all these factors put together, poor remuneration, bad working environment, rising insecurity, unending industrial action, which government is not talking about. All this work together and send the doctor away from Nigeria.
Paint us a picture.
Okay.
Paint us a picture of how crippling this is for the health sector. Let's talk about the hospital, this particular hospital now, Obafemi Awolowo University Teaching Hospital. Not just there, I think there are other places where wards are being shut as well. Paint us the worst case scenario of this continuing.
You know, what is going to happen is this. Look at Nigeria. Let's look at the psychiatric wards that have been shut down. Nigeria is a leading country in substance abuse. We're likely going to see more of psychiatric cases, emotional problems, mental breakdown happening in Nigeria. Who's going to treat those people? Now, the capacity of that hospital to train consultants in that regard will be compromised. Since they are not having sufficient doctors, the wards are shut down, they will not be able to train people. And when you now have a situation where majority of our youth are having a mental issue or psychiatric issue, and they cannot be treated, where do we go to? Are we going to go to church? Now, this is going to come back to every one of us. Now, we're not, first and foremost, if you even want to be a doctor, you must have done science in secondary school. We are not incentivizing the training in science field that will further enhance people to choose medicine. The capacity of the hospital to train is further compromised when you are closing down hospital. So how do we now train doctors? Recently, I observed quite a large number of Nigerian doctors who are going to Sudan, going to Ukraine to train. We saw the outcome. A lot of them came back and couldn't fit into this place. And suddenly, war broke out in those countries. Those people were left without any place to train. So in reality, government wants to do this thing. You have to enhance and improve the capacity of the center to train.
In
If
what specific ways can the government, I know we keep talking about this all the time, asking for suggestions from professionals like you on what government can do, but pending when we see action, we will continue to ask, what are some of the immediate steps that this present administration needs to begin to take in order to find a way to curb the mass exodus of our medical professionals?
It's quite simple. It's just the will. First and foremost, let's agree that we have crisis on our hands and we need to do something about it. Where do we start? We have to push preventive care. We have to push preventive care. The low-hanging fruit is for us to engage and probably push health literacy to the lowest level of the nation. Roll out health literacy, educate people, let them know the simple decision they can take to prevent diseases. Make sure your primary health care centers are working. At least at that level, you may not need high cadre level of workers, but you may be community health workers and nurses and all those people that can do those work at that level. Make those ones are working. Secondly, deepen the learning of science. Let people be encouraged to pick science. Let them be encouraged to be able to choose that they want to do medicine. And also, deepen training, push training, incentivize it, give scholarship, enhance it. And then the doctors that are available, don't let them go away. And you can easily do what we call reverse brain drain by creating a condition that will allow doctors, even in US, in UK, and everywhere, Nigerian doctors to come back and set up practice here. You know, you have these things are interlinked, or else your development is a problem.
Well, we certainly hope that those that need to listen do listen. Thank you very much, Doctor, for speaking with us.